you. Those are wonderful presentations. Thank you to each of you. You know, we have about 30 minutes for questions and answers, and I would like to open it up with one specific question that I really would like to have each of you address, which is, if you were to choose what should be the next policy consideration that would help advance obesity prevention in the groups that you're working with, what would you recommend that we begin to look at as a policy around food marketing that you think would have the greatest impact on adolescents, on targeted marketing, or getting at the issue of the power of integrated marketing? What's the one issue that you think we should focus on? I'm going to let you go first, Mimi.
Well, I would.
Can you turn on? Yes, on top.
Gaming comes to my mind as a real important issue that is certainly focused on adolescents with lots of spillover onto children. And that, coupled with the viral marketing and the self-created, user-generated content.
I heard you say that there really hasn't been that much research on this integrated marketing cumulative impact.
Right, right. So certainly that's something that that ought to be tackled, though it's very difficult. And I think also the kind of report that was done in 2006 by IOM, extending that into the research that now exists, doing a meta-analysis of the research on advert games and viral marketing
would be useful.
And the like would be useful.
Thank you. Catherine?
It's hard to choose one. I'm telling you, I'm, as many of you may know, I'm also involved in some of the policy work here in Washington on privacy, where, by the way, we have made some advances. There's now a major debate going on about privacy data collection and targeting, and I think that's an urgent area where we need some action. And there's a lot going on in Europe as well. So I see that as a central issue. It's not directly connected. It is directly connected, but it's not specifically about food marketing. But this is a big infrastructure, and there are a lot of related policy issues that we need to be thinking about that will need to sort of work together to create the kind of policy environment that we need. But I also have to say, and since this is what my talk was about, that because adolescents have really been left out of the policy debate, I would like to just see some attention paid to them first, and then to think about what we want to propose, which is this idea of a set of fair marketing principles to teens. And I think they need to be looked at differently from the way we look at children. It's not necessarily a ban, maybe certain techniques that we know are not fair, but really to just be much more fair about the kinds of things we market to teens and how we market to teens, and not just set up marketing to try to take advantage of them in every possible way we can come up with.
Thank you. Jerome?
Yes, I don't have a solution, but I know we have to address this issue of the concerns about targeting racial ethnic groups without appearing paternalistic. If you go back, and I've been involved in this area, for many, many years, going back to the alcohol and tobacco days, and the court case about Brown versus Philip Morris with tobacco, in terms of whether you can, whether targeting a menthol cigarette toward African Americans was illegal from a legal standpoint. And in that particular case, I guess the ruling, and not being an attorney, was basically if you offered the cigarette to everyone, even though you offered menthol cigarettes to African Americans, it might have been more harmful, as you weren't really doing any harm to the group. And I think back about some of the cases that and we talk about this in the chapter about community engagement. And you talk about issues like in California, whether you can go into a community and say, look, we're not going to allow any more fast food franchises to be opened in this particular zip code, which, because it has more deleterious health effects, but also happens to be largely Hispanic and African American. I think those are the issues we have to grapple with. And I think particularly now, at a time when people are thinking about voting and rights and possibly historically disenfranchisement, many people think, well, African Americans and Hispanics have been denied certain rights in the marketplace for many years. They've been ignored, so now marketers are going after them. So we have to come up with a way, with a policy of dealing with those issues where people don't feel that their right to vote in the marketplace is being taken away if we place limitations on target marketing. I don't have a solution to it, but I know that that's a very sensitive area that we have to deal with.
And in California, there was pushback from the community.
Definitely, there was
that
push.
asked that there not be limitations. Yeah.
Right.
Okay, we'd like to open it up to the audience for any of your questions. And what I would ask is, if you would like to ask a question, if you could go to either side of the room where we have microphones set up, because if you don't use the microphone, your question won't be captured for the web audience. So please, are there any questions from the audience?
Thank you for those great presentations, very stimulating. My question has to do with the applications of system science to studying integrated marketing. The Standing Committee and the Accelerating Progress Committee report from the IOM talked about using more systems thinking to try to figure out how all the things fit together. And it seems to me that probably are marketers using this, or are they just lucky, I mean, in terms of making it all fit together? And is there a way that we could apply the formal techniques of system science to get a handle on what's going on?
Do you want to answer? I can comment on that because I've been struggling with this question for a long time. And I do want to acknowledge the Healthy Eating Research Initiative for supporting our work in this area, and Mary's story. Because what we've been really trying to figure out is how can we take advantage of what we are learning about the industry techniques for measuring the impact of these campaigns that might be adapted in some way for use by the health community to try to understand what the health consequences are. I think that one of the clues may be in the variety of different kinds of metrics that industry is using. Now, some of that is obviously very proprietary, but understanding the various things that industry measures and counts, from measures of engagement, Mimi talked about engagement, to the way fans activate each other, and measures of influence and peer influence and relationships among young people in the marketing environment. I think what we will need will be new methods, and some of them may need to be more qualitative, for example. I think there's room for some exploratory studies, and certainly when it comes to adolescence, we could just need to start somewhere, you know, in terms of looking at this. And when it comes to integrated marketing, that, you know, a lot of marketers use qualitative research. The fact of the matter is a lot of these measures are built into the system, so they're automated. They are part of how Facebook works, for example, to know exactly what the impact of a message is and of a campaign is, or a multiplicity of techniques that are used in a campaign. But I think we need to know more about those things, which is what we're trying to do, and we're going to be releasing a report that gives some suggestions for where we might be able to start. And we're working with a network of researchers struggling with this together. But I think we've got to begin to answer that question.
Yeah, I think it involves obviously drawing from other disciplines in social psychology, drawing from sociology, cultural analysis, drawing from anthropology. And so it takes a different research paradigm than what marketing and advertising has been in.
Speaking of other disciplines, I'm over here.
Leanne?
Yeah.
Oh. I'm a developmental psychologist, and I couldn't help but think about what I see as a major subtext in all of this, which is the vulnerabilities in terms of where kids are with the development of emotion regulation,
Right.
decision-making
That's
processes, and all of the new literature, frankly, that's coming out in terms of work on brain development during those periods of time, and the implications of that work for what you're doing, and of the kind of unique potential outcomes relevant to these different age groups. Would you just care to comment on that?
Well, I'll be happy to. Yes, we've actually worked with some researchers and who've done a couple of papers specifically about this. One of them is Agnes Nairn in Europe. but there are also others who've been making the connections between the digital marketing environment and the techniques that are used there and the vulnerabilities and all of this research on adolescence that you're talking about. And it's interesting because we just reviewed the NAS study of risk-taking among adolescents, which is a very good compilation of the research on brain development and mood changes and impulsivity and all of the kinds of things that are involved with risk-taking in areas related to sexual behavior, to driving, and to alcohol and drug consumption. But food marketing was not mentioned, and food behaviors, food-related behaviors and obesity were not mentioned there. So there need to be more connections made. And we need to draw more on the really wonderful wealth of research there to inform the research design and the discussion among researchers looking at food marketing. That's in this contemporary era. I'm not even going to just say digital. I'm saying it's all digital. That's how we have to look at it. And the kinds of techniques that are used that are purposefully designed to foster impulsivity, as you saw in a number of them, but certainly in the example that I showed of the Doritos campaign, this is tapping into these sort of tendencies, these behavioral qualities, and the kinds of things that teens are dealing with at this age. So, you know, it's very, very carefully orchestrated in that way, and we need to understand that better, and I think we need to expose it.
Let me just add one thing. I think one of the things that's a little bit disheartening to me as a researcher is that as an academic, and I think in the public health area, we're so far behind the industry in looking at many of these issues. And to give you a typical example, I referred to the kids research that we wrote this chapter on. And we came up with some relatively good results, but I think it was David Britt that sent me a note one day and said, hey, why don't you look at these kid affinity scores? And we got a small grant to look at it. And I contacted the company, and they gave us really what was already published data. And then I guess they did a little bit of background on my research on my background, and they weren't sure what I was going to come up with. And we'd already agreed to buy the data that would give us the opportunity to do this, and then they refused to sell me the data. And I don't think it was so much that they had any concern about public health issues, but they were concerned about all the industry clients that they had to buy that same data, and whether they would feel that they would be giving data to some academic who might come up something that was contrary to what the industry wanted to hear. And they actually refused to sell us the data to conduct the kind of research that we wanted to do.
Thank you.
Angela, and then we'll go to Bill.
Thank you. I thought it was interesting that Kathy Montgomery was talking about how individualized marketing was becoming more and more the norm, and how African Americans and Hispanics had higher smartphone and cell phone ownership and use. And then Jerome was talking more about ethnic marketing as a group, as a demographic. And I'm just wondering whether you're seeing more individualized marketing based on ethnicity or race, and what issues that raises.
Let me just, I'll mention one thing. One of the other areas of research I deal with is discrimination in the marketplace. And I've done a lot of work on that, consulted with many court cases and so forth. And one of the things we found is that among African Americans and Hispanics, they, as Catherine mentioned, they rank very high on social media and all kinds of, like using Facebook and all of those things. And part of it that we've uncovered is that there's been such a history in this country of the treatment face-to-face in a retail environment, what we call the brick-and-mortar store, that many times opportunities to be marketed to in a way where your race, in a sense, is not really as visible has been very appealing. And so I think we found some evidence of that. And so I think that's one of the factors that we've seen where there's been a much greater response for many of these types of techniques.
So that you're saying that the African American youth prefer to use the non-brick-and-mortar places, and the marketers prefer to use those as well to reach them.
Right.
And I do think this whole issue that you've raised is an important one, Jerome, about, because I just went to a marketing, it was Ad Week in New York City a couple of weeks ago, and I went there to give a presentation at KRU, at the Children's Advertising Review Unit, but then I also went to one of the multicultural marketing panels. And you know, to hear from people in the industry about how those groups were basically ignored for so long, and that they really want to be included in the marketing that takes place was an important thing to hear. At the same time, the idea that being included also may mean various kinds of discrimination based on your ethnicity or your race. I mean, and we're talking about a whole lot of factors that can be used in the personalized marketing that takes place, all under the radar, things that are really not clear. We don't really know what's going on. And by the way, it happens as well in the political campaigns. There have been some recent articles about the personalized, targeted marketing to individuals in the campaigns, in the electoral campaigns, where you will get a different message from your neighbor, and it may be based on your own biases. You know, who knows what it's based on? It may be based on a whole lot of things they know about you that they know can get to you, and that's the whole idea behind it. But it also opens the door for various kinds, new kinds of discrimination that are not visible. So it's a very difficult thing to get at, and I think it's going to be a challenge for us to try to figure it out, but an important area, another important area we need to look at.
Thank you. Bill.
Bill Dietz, member of the Standing Committee. Thank you for those presentations. Those were really terrific. And it's stunning just how immersed in media adolescents and children are. And I was thinking that the exposure to food marketing is just one element of this issue. And I wondered if you could comment on your thinking about whether there's a broader alliance to be built around critical thinking, helping children and adolescents through this media and to basically immunize them, if you will, around these types of exposures, and whether that wouldn't be a tactic which might allow us to develop a broader alliance of interest that would go beyond just the food marketing.
Well, I certainly think that's an important factor to get into this. You're really talking about media literacy and critical thinking around media, but I think what mitigates against that is the enjoyment, the entertainment, the flow that people get into as they participate in this, which neutralizes that and may even create these positive associations with the nutritional value of the products. So I certainly think there's a role for that, but I just think it has some limits when we get into these media that are so enjoyable.
Go ahead.
I don't know. I've been talking about this for a long time in a kind of ideal sense, and I know Cheryl Hilton is here and will speak later, but talking about the Truth Campaign as a model that where we can really empower young people to understand how they are being manipulated through these media. And encourage them to take action, the same way that we want to look to communities to be able to take action against techniques that are being used that are unfair to them. But I do agree with Mimi. I think it's pretty challenging. And I think that when you look at social media as an example, young people are really living their lives in these social media platforms and networks. They've taken ownership of them. And the companies that run them are also purposefully cultivating these relationships and creating a very positive association. And research has shown that social media provide young people with social capital, access to all kinds of wonderful resources. It empowers them to be involved in politics. There are all kinds of really very good things about it. So I think our challenge will be, and I deal with this, and I'm sure we all do when we teach our students, is to get them to understand the kind of sophistication that's being used and the techniques that in many ways are purposefully deceptive, purposefully unfair, which is why we focus a lot on the techniques. And as well, you know, the health consequences of what they're doing. But it's an uphill battle. It's a real challenge because they are clearly being socialized into the system, and a lot of their behaviors are becoming, in a way, a function of this machine they're part of. I know that sounds incredibly paranoid of me, but having looked and continuing to look at how these things are structured and how they're really designed to encourage young people to be part of this marketing machine, it's really kind of frightening in a lot of ways.
Yeah, I'll say too, the whole issue of privacy, I think our view of privacy is quite different than young people's view of
Adolescents, yes.
privacy. I
Although
mean,
there's recent research that says they do care about it, because I know I have companies sometimes say, well, they don't really care. Forget about privacy. Kids don't really care about privacy. In fact, they do. I don't think they totally understand, though, that privacy is a right for them, and I also think that they're under a false belief that they can control their information. And of course, if you look at Facebook as an example, and Facebook has been challenged numerous times, and many of the policy initiatives that the company has put out have been in response to attorneys general, Federal Trade Commission, Europe, consumer groups, etc. But nonetheless, they tell young people that they can control who gets access to their information. They don't really explain this under the hood system that is tracking them everywhere they go and creating dossiers on them. They don't really understand that, and I think most adults don't either.
Take another question.
Good morning. My question specifically relates to something Mr. Williams said, but I'd be very interested to hear from all of the panelists. I was really interested in what you mentioned in the shift from the marketing of products to the marketing of a brand, and how you see this impacting both the need to continue developing and strengthen regulations for marketing to children.
yeah, I think that's, if you look at marketing overall, there's what we call primary demand and secondary demand, or secondary selective or brand demand. And so a company can advertise, like, let's say, to engage in certain behaviors without being brand specific. But then there's also brand advertising. And so what I was trying to allude to is the fact that you can have advertising for a Big Mac or a Whopper, but at the same time you can advertise McDonald's as a corporation. And once, just getting you into the place is sufficient. And then you can make your choices once you're in the place. And so targeting can occur on that level where there's just a feel-good attitude about the company and the corporation, and you can shift money there. And then when you start measuring certain brand advertising, like when the data sets that I look at, usually it's broken down by brand. So what sometimes can escape is this whole upper level of targeting that's at the corporate level that doesn't get included in a lot of the analysis that I do at the brand level.
It also could be the case that if you market McDonald's, then you don't have to market the specific Happy Meal and specific kinds of foods, and it still has the halo effect, and it still has the effect of promoting sales at McDonald's for foods that may be problematic. David.
Yeah. It seems to me that the premise of targeted and behavioral marketing is to increase and reinforce either tendencies that are developing or that are already there in terms, in this case, of food consumption. Do you know of anybody who's really started to look with 1/3 of kids and teens being overweight or obese already, the likely impact of effective targeted and behavioral marketing in terms of not just making more kids overweight, but making the kids that are overweight even more so?
I don't know of any research that I have access to. It's a concern that I have, though. So, for example, if kids are already overweight or obese, they're playing video games, which may contribute to their overweight or obesity, and in the video games are targeted marketing efforts around pizza or whatever kind of food it is that they already know that kid likes, and that then you're also able to follow the kid elsewhere. That seems to me exactly the kind of thing that concerns, that is one of my major concerns about behavioral targeting. That, in other words, they already know you like a certain product, and it may be that product that's helped contribute to the problem you have. Combine that with a behavior that you're engaged in online and merge them together and follow you and reinforce all of that. That is powerful. And to the extent that that is the kind of paradigm we're looking at, that is a huge thing we're going to have to respond to.
And do we have empirical demonstration of the power of that with research on adolescents or children?
Well, I think we do in terms of research on adolescents generally. In individual cases, no. But if we look at what we were talking about earlier, in terms of what we know about adolescent tendencies, during that period of their development. You put them in that kind of immersive environment where they're encouraged to be impulsive. You create, and we haven't talked much about the phone business, but think about a mobile phone campaign, and that's where it's all going. And the mobile phone is going to be the first stop, the most important screen for reaching young people very, very soon. Mm-hmm. So think about a mobile campaign that's also social, that involves location marketing, that can target an individual based on that individual's behaviors. And let's use that same kid who's now maybe hopefully walking around with that mobile phone, not just sitting there playing those video games, but they're playing those video games on the phone anyway and interacting with friends. And now you can actually reach that child with the persuasive message at the point of purchase, and the phone itself can become the mechanism for making that purchase.
Oh, and
mention discounts.
And the Dorito example certainly demonstrated the power of purchasing for that group. Margot.
Hi, I'm Margot Wu-Tan with the Center for Science and the Public Interest. I wondered if the panel could talk a little bit more about the age groupings that we usually look at for food marketing to kids. Is that just dictated by Nielsen because we have, things are targeted for under 6, under 12, and then teens? Developmentally, what age groupings do you think would be ideal to look at different marketing policies for? And now with micro-targeting and different kinds of more targeted media, is there the possibility of looking at different age cutoffs? Like CAPA uses 13. What should we be looking at for the age cutoffs for different marketing policies?
Are you directing that to me, Margot?
No, and I think Jerome too has, I think Kathy, you have some ideas about this, and I think too, Jerome, also, are we just really just using the slots that the industry gives us because that's how we buy advertising?
Let's inject a little bit of history here.
Yeah,
and,
I was hoping you'd comment.
The age grouping, which has covered special relationships for children 12 and younger, CAPA at 13, it's 12 or 13, really comes out of a literature from the 1970s when there was research on how children of different ages make sense of television advertising. And I know about it because I was a graduate student at the time, and that's the research that I had been working on. And what the research uncovered then is that children below 5 had difficulty identifying the persuasive intent of a message, and that they had difficulty even they made distinctions between an ad on TV and the program on physical characteristics. The ad was shorter, they had different kinds of music, etc. Even going up to as old as age 12, and it wasn't until about 12 that children had demonstrated the ability to identify the persuasive intent. They could tell you that ads wanted to sell you a product, and as a consequence of that they should perhaps be wary in scrutinizing that message. That literature on children's abilities to understand the persuasive intent of television advertising became the basis of regulating advertising and protecting children at age 12 or younger. We're in a whole new environment now in which it may very well be, as the argument is being made, that even adolescents have difficulties in protecting themselves or understanding the nature of the kinds of marketing that's being directed at them. So when you begin to ask the question, I'll stop, but when you begin to ask the question of at what age should we be concerned with, clearly there are age groupings that are of different interest. Below age 5, there's the development of executive functioning, there's desire to understand how children understand this environment at all, and it's fairly limited. Between 6 and 12, there's the beginning of an understanding, but we haven't done, as I understand it, a lot of research to know if children in that age group even are aware of or can identify the newer kinds of marketing techniques. And as Catherine's been demonstrating, even adolescents have difficulty. And I might add that I suspect that adults have difficulty recognizing the nature of the kinds of advertising that's directed to them. What's more disturbing in looking at all of this is that in the era of the 1970s, when the persuasive intent issue came up, parents could see those ads that their children were being exposed to. They could see them on television, they could see them in newspapers, in magazines. Now, parents are not aware of what's going on and can't even talk about it because children are using a different set of media in their lives from the adult media. So it's really a completely different marketing environment. I'm sorry, I went on very long.
No, that's
No,
good because that's what I was
answers
going
it.
to say. And I think it's from a regulatory point of view, it's really challenging. But I think that the cognitive theories upon which that early research is based don't go far enough, because we're not talking now about knowing whether it's an ad or not an ad, especially when you can't tell anyway, as Ellen was just saying. I mean, there was an article yesterday in the Washington Post, for example, about what is an ad, and I was just on a panel at KRU in New York about what is an ad. And you know, now, as we know, and this unfortunately has been the case from the very beginning of digital marketing in the 90s when I first got involved in this, it's completely integrated with the entertainment and with the content. And one of the things we really called for, and it was based on that early research on television, was that there be some separation, some meaningful separation between advertising and so-called content, particularly for younger children. But the issue is also raised when you look at some of the examples that we showed with older teens as well. But unfortunately, we didn't push for that as hard as we probably should have. We got COPPA, we got privacy protections, and we now have a totally integrated system.
If I could add one footnote, one big problem is companies don't buy this paradigm shift from persuasive knowledge to this broader understanding of development and vulnerabilities of teenagers.
You got to work on
I believe
them.
that. Please join me in thanking the panel one more time.
Thanks, Ellen. That's good.
And we are going to take a break now until 12:30 for lunch, and I'd like to let you know that there is a cafeteria on the 3rd floor, and we will reconvene at 12:30. Is that the time? Yes, at 12:30. Thank you very much.